There are two types of Medicare coverage that confuse millions of Americans every single year. One pays almost nothing upfront but could cost you everything if you get seriously sick. The other costs more every month but gives you a financial ceiling so you never get hit with a bill you can't pay. Today I am breaking down Medicare Advantage versus Medigap so you can figure out which one actually makes sense for your situation and your wallet. Before we get into it, let me tell you something most Medicare commercials will never tell you. The plan with the $0 premium is not always the cheaper plan. In fact, for a lot of people it ends up being the most expensive decision they ever made. By the end of this video you will know exactly why and exactly what to look for. Let's start with the basics. When you sign up for Medicare you get Original Medicare, which is Part A for hospital coverage and Part B for medical coverage. Original Medicare covers about 80% of your approved costs. The other 20% is on you with no cap. That means if something serious happens, a cancer diagnosis, a major surgery, a long hospital stay, that 20% could wipe out your savings. That is why most people add extra coverage on top of Original Medicare. And that is where Medicare Advantage and Medigap come in. What is Medicare Advantage? Medicare Advantage is also called Part C. Instead of using Original Medicare directly, you sign up with a private insurance company that takes over your Medicare coverage. These plans are required to cover everything Original Medicare covers, but most of them add extra benefits on top like dental, vision, hearing, and prescription drugs. And here is the part that gets people hooked: a lot of Medicare Advantage plans have $0 monthly premiums. You still pay your Part B premium, which is about $175 a month in 2024, but the Advantage plan itself costs you nothing extra every month. Sounds perfect, right? Here is what they don't tell you in the commercials. Medicare Advantage plans have networks. That means you can only see doctors and go to hospitals that are in the plan's network. If you go out of network, you could pay significantly more, or in some cases nothing gets covered at all. Medicare Advantage plans also have copays every time you use the coverage. Doctor visit copay. Specialist copay. Hospital copay per day. These add up fast. And while every Advantage plan has an out-of-pocket maximum, in 2024 that maximum can be as high as $8,850. If you hit that number, you have paid nearly $9,000 out of pocket before the plan covers everything at 100%. So the $0 premium plan could still cost you thousands of dollars if you actually need to use it. What is Medigap? Medigap is also called Medicare Supplement Insurance. Instead of replacing Original Medicare like Advantage does, Medigap works alongside Original Medicare to fill in the gaps. That is literally where the name comes from. You keep Original Medicare, you add a Medigap policy, and together they cover most or all of your out-of-pocket costs. The most popular Medigap plan right now is Plan G. With Plan G, after you pay your annual Part B deductible, which is $240 in 2024, Medicare and your Medigap policy cover essentially everything else. Doctor visits, specialist visits, hospital stays, surgery, covered. You know exactly what your costs are going to be every year. No surprise bills. No network restrictions. You can see any doctor in the country who accepts Medicare, which is the vast majority of doctors. The catch with Medigap is the monthly premium. Depending on your age, your location, and the insurance company, a Plan G policy typically runs anywhere from $100 to $200 a month or more. So you are paying more upfront every single month in exchange for predictable costs and unlimited provider access. The real cost comparison. Let me break this down with real numbers so you can see what this actually looks like. Let's say you have a Medicare Advantage plan with a $0 premium. You go to the doctor 4 times a year at $20 a copay. You have one specialist visit at $50. That's $130 for a normal healthy year. Not bad. But then something happens. You need surgery. You spend 3 days in the hospital. Suddenly you're looking at hospital copays, surgical copays, anesthesia copays, and follow-up visit copays. Before you know it, you've spent $4,000, $5,000, $6,000, all the way up to that $8,850 out-of-pocket maximum if things get serious enough. Now let's look at Medigap Plan G. You pay $150 a month in premiums. That's $1,800 a year. You pay your $240 deductible at the start of the year. After that, almost everything is covered. That surgery and hospital stay that cost you thousands on Advantage? On Plan G, your cost is essentially zero after the deductible. Total out of pocket for the year, $2,040 no matter what happens to you medically. For healthy people who barely use their coverage, Medicare Advantage often wins on cost. For people with chronic conditions, ongoing health issues, or anyone who wants to know exactly what their healthcare will cost no matter what, Medigap usually wins. The network problem with Medicare Advantage. Here is something that catches people completely off guard. You sign up for a Medicare Advantage plan and everything seems fine. Then your doctor leaves the network. Or you move to a different state. Or you need to see a specialist and the one you need is not in network. With Medicare Advantage, you are stuck. You either pay out of network rates or you find a new doctor. With Medigap and Original Medicare, you can see any doctor anywhere in the country who accepts Medicare. If you travel frequently, if you spend part of the year in a different state, or if you just want the freedom to see any doctor you choose, Medigap gives you that flexibility completely. The switching problem. Here is the part that nobody tells you until it's too late. Getting into a Medigap plan is easy when you first sign up for Medicare. During your Medigap open enrollment period, which runs for 6 months starting when you turn 65 and enroll in Part B, insurance companies cannot deny you coverage or charge you more because of health conditions. You get in no matter what. But if you start on Medicare Advantage and later decide you want to switch to Medigap, that guaranteed issue protection is gone. Insurance companies can now look at your health history and they can deny you coverage or charge you significantly higher premiums based on pre-existing conditions. In most states, if you have serious health conditions, you could find it nearly impossible to switch to Medigap at all. This is the trap that catches thousands of people every year. They start on Advantage because of the $0 premium, they develop health conditions, and then they cannot get into a Medigap plan when they realize they need it. So which one should you choose? Here is the honest answer. It depends on your situation. Choose Medicare Advantage if you are generally healthy, you want extra benefits like dental and vision, you are comfortable with a network, and you want to minimize your monthly costs right now. Choose Medigap if you have ongoing health conditions or chronic illness, you want predictable costs with no surprise bills, you travel frequently or split time between states, you want the freedom to see any doctor anywhere, or you want to lock in your coverage while you are healthy and guaranteed to get approved. One thing I will say to almost everyone: if you are healthy and just turning 65, seriously consider starting with Medigap while you can get in with guaranteed issue rights. You can always switch to Advantage later in most cases. Going the other direction is much harder. The best thing you can do right now is compare plans in your area side by side. Medicare.gov has a plan finder tool that shows you every plan available at your zip code with real cost breakdowns. Use it. Spend an hour comparing your options before you make a decision that affects your healthcare costs for years. Let me recap everything we covered. Medicare Advantage has low or zero premiums but comes with networks, copays, and high out-of-pocket maximums. Medigap costs more monthly but gives you predictable costs and freedom to see any doctor. Healthy people often do fine with Advantage. People with health conditions or who want certainty often do better with Medigap. And the switching rules mean that getting into Medigap is easiest when you first become eligible, so do not sleep on that window. If this helped you, drop a comment below and tell me which plan you are leaning toward and why. Subscribe because next week I am breaking down the hidden Medicare benefits that most people never claim. See you then.